Welcome to the Show Me on the extraocular muscles. The very first thing we have to think about when we think about the orbit is that our eyes started off in embryology much more laterally, and they move their way round medially in development. So I'm going to start off by drawing one orbit. As you can see, it's a cone shape. There is a common tendinous ring here, which is going to be an attachment point for 4 of the recti muscles, and the first muscle we're going to consider is going to be the superior rectus. So our superior rectus muscle starts its life off here, comes forward and attaches to the superior surface of the eyeball. Let's draw it down here. Now, as you can see, the orbit is angled slightly laterally, but life and all the exciting things that are happening within life are going to be happening straight ahead. So life, sunshine, etc. is happening straight ahead of us. So this means that the angle of gaze is facing forward. So I'm just going to change colour and draw this angle just with a dotted line running down this way, so we can see life working our way forward. Now the superior rectus muscle, its angle is coinciding with the angle of the gaze, so when our superior rectus muscle is going to be contracting, it is going to cause elevation, but also it's going to pull the eye medially. So it's going to work this way. Now, if we want to test the superior rectus muscle clinically, it is not going to be the only muscle that is going to be elevating the eyeball. The other muscle that elevates the eyeball is the inferior oblique. Now, to stop that inferior oblique muscle coming into play, what we can ask the patient to do is to move their eye laterally. So if we ask them to move their gaze this way, this makes the inferior oblique muscle become quite short, and when muscles are short they don't work as well. They work better when stretched. So the inferior oblique muscle then doesn't come into play, which means if we then ask our patient to look superiorly, we are just then using the action of the superior rectus muscle. We're now going to think about the inferior rectus muscle. So it's obviously inferior to the superior rectus, so I've kept the lines on here but just removed the lines of action. The inferior rectus muscle is responsible for depression of the eyeball, but because of this angle it also acts to medially rotate the eye as well. So its action is going to be back along here, anatomical action just like that. Clinically, if you want to test the inferior rectus muscle, you also need to isolate it. Remember that the other muscle which is helping towards moving the eye down is the superior oblique. So we want to move the eye this time again laterally. So you'd ask the patient to look laterally, and then once you've done that, you've then turned the superior oblique muscle into a shorter muscle, so it's not going to be working, and then you ask the patient to look inferiorly, so you are then just testing the inferior rectus muscle. Now, with a little bit of redrawing, we can now look at our superior oblique muscle. So our superior oblique muscle is still coming from this common tendinous origin here, but is running forward, and it then attaches to its trochlear just about here, and then inserts onto the eye, so it turns a corner this way. And because of this, it means that it pulls the eye downwards and outwards. Which I guess it's drawn that way, like that. To test the superior oblique muscle, you ask the patient to look medially and inferiorly. Now we're going to think about the inferior oblique muscle. It's a much harder muscle to draw because we imagine that this is a see-through eyeball and we're drawing it along this axis, along here, and the primary function of the inferior oblique muscle is to move the eye upwards and outwards. So this is represented by this here, and if we would like to test this muscle, we ask the patient to look upwards and inwards. The medial and lateral rectus muscles are much more simple because the medial rectus is going to pull the eye towards the midline, and the lateral, as its name suggests, and so the clinical testing of that is the same. And that's your eye muscles all sorted.